All right, so I think we have some more people who are joining. So why don't we get started?
Okay.
Welcome everyone to another Apollo webinar. We actually have a guest who has joined us before, who is a close friend and colleague, who is a pediatric and correct me if I get any of this wrong, Amy, but a pediatric and family nurse practitioner. And who is psychiatric, nurse practitioner, who works with the Children's Integrated Center for Success, which is an incredible clinic based in Pennsylvania that provides mental health care of the highest standard to children and young adults and families. And one thing that always fascinated me, and for those who don't know, I'm a psychiatrist and a neuroscientist, and I'm the co-founder and chief innovation officer of Apollo Neuroscience. And one thing that's always fascinated me about the work that Amy does and her team at CICS is that they really focus on non-invasive, risk-free approaches first that are really focused on empowering the kids and their families to understand how to heal naturally, how to do sort of like a wide variety of approaches that are focused on minimizing risk and really making the children feel at the center of their own healing experience, which is so important. Because I think a lot of the time, even as adults, especially in mental health care, we feel, but also in physical health, we feel like we're kind of like, passengers on our own healing journey, not drivers. And I think it's really about healing is about stepping into the driver's seat, recognizing every opportunity we have to step into the driver's seat and take control of our own healing journey in every moment that we can in our day-to-day lives. So Amy, thank you so much for joining us. Really appreciate you taking the time. I know it's late over there in Pennsylvania. So really appreciate it. And just grateful to have you.
Well, I am excited to be here. Thank you for inviting me back. Today we finished moving out of one space and into a new one. And so I am happy to say that this is truly the best thing I've done all day. I was looking forward to this all day. So glad to be here.
Yeah, moving is really, really tough. Talking about stress, right?
Right.
So
yes.
So we have a lot to cover today, so might as well dive in, and we'll do a Q&A as well. And for anyone who wants to ask questions, please feel free to post your questions in the little Q&A tab on the bottom right in Zoom. And we will get to as many questions as we can throughout the 90 minutes that we're here. And if you want to post in the chat, you can feel free to post in the chat. But typically the best place to post questions, if you have questions, is in the Q&A section. So the first thing that I think we should, unless you want to start with something else that you have on your mind, Amy, is sort of, we're really facing a lot of challenges now in the community. We're staying right now, we're like living with our friends who are parents of young children. We've spent a lot of time together in the past with them, and it's always interesting. My wife and I don't have children yet, but it's always interesting to work with children in a clinical setting, and then also to spend a lot of time with children at home in a family setting, and to see how different the approaches are, and also to really get a sense of what are the stressors that kids are really facing, what do they perceive as stressful for them, and what kinds of things do they typically turn to try to feel better and navigate those stressors. And given the current challenges we face in our society with COVID, homeschooling, going back to school, having a lot of social distancing still as an issue, and just a lot of stress involved in just the potential threat of other things that are on the horizon that are not just uncertainty, right? Mm-hmm. What's the best way or what are some of the best ways to support children who are going through some of these challenges right now? And of course, what are some of the biggest challenges that you see in the kids that you work with?
I would say that it's changed across time. So everybody were what, a year and 3 or 4 months into the onset of the pandemic, and most people at this point have experienced lockdown for some period of time, whether it was a couple weeks, couple months, off and on. And so I think that when we first experienced lockdown and the fear was really high, there were a lot of unknowns, and everybody was in this kind of hunker down mindset. It was a time of, it was so interesting because it was a time in a lot of ways for families that was a golden, because it was like a big vacation. It was like the vacation that they didn't get around a holiday because they were just home living their life, not necessarily planning big meals and presents and all the stuff. And so I think there was in the beginning a real sense of reunion, connection, lots of good things were happening. I think there was a lot of I know there was a lot of leniency. People were just learning how to work from home. Jobs were important, and also everybody was very understanding. If your dog barked in the meeting, or yeah, it was so new, and there was this lovely time where it was still, the decreased expectations, and that's changed. That's shifted. So now this is our normal, and for children and families, that means a hybrid, usually of working at home, sometimes going into an office, doing school at home, sometimes going into school. None of it static and none of it predictable, which, if I could point to the first thing that I see as the biggest challenge, is it's very difficult to know what to expect, and things change quickly. And there are schools that are opening, and I'm hearing from families, we're supposed to open next Tuesday, but we haven't heard anything, and it's Wednesday, less than a week away, and we don't know. So there's this, consistent feeling like you're in a flux, and you're always having to second guess or have plan A, B, C, D, E, just to get through a week, which is probably the most stressful thing that I hear people talking about. And that would be for kids and for parents.
Yeah, that's a great point. And we, as a psychiatrist and therapist, I talk to people about this all the time, because everyone comes to me and they say, it's probably similar to you, and they say, like, I feel so anxious and I don't know why, right? I'm so worried and overwhelmed and I don't know why. What's going on? Is it just me? Is there something wrong with me that I am feeling this way? And my answer is almost always no. It's not something that's just wrong with you. This is something that we all are experiencing right now, in particular, worse than usual. And at the same time, going back to what you just said about sort of that constant uncertainty that we're facing now, even with things like, when is school going to start? How do we prepare for something we don't know when it's going to happen, right? And when it really comes down to it, what we're talking about is really like the source of where anxiety comes from, right? Anxiety comes from spending what limited attention time we have in our day-to-day lives paying attention to things that we don't have control over. Mm-hmm. And that feeling of being out of control, whether you're an adult or a child, is really overwhelming, especially when it takes over a lot of our time each day. We only have so many hours each day that we're awake and clear to focus on anything, and the things we focus on become part of our consciousness. It becomes part of our sense of self, part of our awareness. And the more we focus on those things, the more of our consciousness it takes up for children and adults. And so if we spend more of that time, simply put, focusing on things we do not have control over, or focusing on things that are uncertain, we feel uncertain and out of control more of the time. To the contrary, right, one of the solutions that we work with people oftentimes on is structure, and teaching people how to focus on things they have control over, starting with breath, starting with movement, the practice of exercise, getting any kind of exercise, even just a little bit, is very helpful. Practices of like gratitude and compassion and showing love to each other and ourselves is one. Those can be sometimes really great to teach kids. other times they can be very challenging to teach kids. And so one of the roles, I'd love to hear a little bit about how you help families and children with this, especially with structure, right? Day-to-day structure, circadian rhythms, the sleep and wake cycles, and making sure those are steady. Apollo is a great tool that we've talked about a lot, right? That helps to set help kids wind down at their bedtime and then get energized when they need to be energized and focused when they need to be focused, so that they have more structure during the day, and that structure helps them feel, and us feel, I'm wearing one right now, more in control of how we feel, which therefore helps us be more calm and more resilient throughout challenges that we face on the daily. But I'd love to hear, what do you see as the importance of structure especially right now, but in general, and what kinds of strategies do you use with kids and families in this regard?
Right. So structure is really the key for children, in terms of being able to establish. I think of it as a rhythm. So, I think of everything in terms of music or sound. That's why Apollo is so great. It establishes a rhythm in terms of the child's experience. And that is a way in which they can set the clock around their day, their night. And so structure with routine, structure with meals, structure with food, structure with, the ways that we normally are very unstructured or tend to be less structured about. Bringing some of that back into awareness has been helpful, because those are the things you can change, or that you have some control over. So, having three choices of a drink, maybe two choices of a drink at a meal, so that you're reinforcing the idea that you have options, you can choose, you do have a say. Those small things are very empowering to children. As far as the parents are concerned, the structure is, the same in terms of their care, their self-care. So sleep, what you eat, exercise, the things that you talked about that are very, I think of that as really low hanging fruit, in terms of things that you could start doing right this second, right now, that can have really dramatic impact on your overall stress level across time. So, parents, it's the structure of, did you remember to drink enough today? did, did you do anything
Enough
physical?
water.
Right. Yes. Yes. Did you drink enough water today? Okay, so you can't exercise. You can't, it's miserable weather, and, you can't go to the gym. So how many times do you walk up and down your stairs? It's really kind of rethinking very simple things that you can do to replace the things that you did do, or, can't do now. And that's really important. Often parents will focus so much on children because they love them, and they quickly forget that they have limits to capacity and resilience needs too.
Yeah, absolutely. And I know this is a slight tangent, but you did mention it, so I feel like we have to talk about it a little bit, which is children are basically sponges, right? They're sponges of information. They, without even knowing it, they are always learning from us, and they learn from what they watch, especially the other people around them, especially their parents and the people they respect. Can you talk a little bit about role modeling structure rather than imposing structure, and why that can be a really powerful tool?
Sure. One of the ways that we think about teaching that is kind of an exercise of just talking out loud. So, because children are always listening and always aware of what's going on, parents can kind of have fun with it. So, talking out loud is, yeah, so now I'm going to go down and make sure that I get a full glass of water, because I'm a little thirsty, and I know when I'm thirsty, if I don't drink water, I'm not going to feel good later. So it's almost like narrating your experience and saying out loud what you're doing and why. It's also fun because kids will inevitably say, you what? You what? how much water, or what are you doing? And it leads to a really cool, it can open up a really cool conversation. The other thing is, of course, including kids in activities where you are doing something for yourself in the name of providing structure or regulation. So, every morning I wake up and I do a 15-minute stretch routine. Do you want to come? Do you want to see what I do? Do you want to? Why do you do that, mom? It leads itself to kind of organic, natural learning. For the children. And then also, when you're not okay, saying out loud, oh, I have a little bit of a headache. I probably didn't drink enough water today. Or, I don't know if I ate the last time I ate, I should get a snack. It's usually that when I have a headache. So again, just kind of narrating your experience and teaching in this kind of organic way.
Yeah, absolutely. And we talk about this a lot in the way of two different kinds of learning. So one kind of learning that we've used for many, many centuries is called top-down learning. And this is the kind of learning that is typically experienced in schools and in the medical profession, in the Western medical profession, where we say, you come to your doctor, you come to one of us, and the most of us are trained to say, okay, this is what seems to be going on with you. Do X, Y, and Z this often, and you will start to feel better. As it turns out, even when people are paying for their healthcare provider or teacher or mentor to tell them these recommendations, and they're asking for the input, the rates that we follow, what we call the adherence rates of following those recommendations, are usually only 50% or so, which means that when you're going to your professional and you're asking for help, simply because that person is telling you to do it, you're only 50% likely to complete what they're telling you to do at the way they're telling you to do it, unless you're really motivated and bought into it from the beginning. And I think this is even less with children from what I've experienced. I'm not sure the exact percentages. With the other form of learning that we've known that's much older than top-down learning, where you tell someone what to do, is called bottom-up learning, which is actually how it's called, or it's also known as experiential learning. So it's when the body or our physical senses, our feeling, our intuition, our eyes, ears, nose, mouth, whatever it is, we experience something, we see someone else do it, we see it done on TV, or we see it done in person. In person is always better. And then ideally with a role model present that we feel safe around. And then we, just by watching that person do something and seeing the results being positive, we make it, our body and mind make an automatic association. Says, if this person can do X and get to Y and Z, then I can also do that. Mm-hmm. And then it starts to become sort of more subconsciously ingrained as habit that are positive. We also bottom up learn things that are not so positive as well, which is why it's important to question what we learn before we set it into habit. But the bottom up learning and the way we role model for people is so important. And that's actually how touch therapy works. It's how music then sound therapy work, and it's how Apollo works, because it acts on the body first and then the mind second. So if you calm the body through experience, then the mind will follow, which is really interesting.
Yes, absolutely. And that brings up a really important point about regulation. So, learning happens best in a well-regulated state, meaning not too intensely emotional, not too physically excited. And so that is also something that we encourage kids and families, a lot, is to find all of the ways in which they regulate, can self-regulate, learn regulation, and practice it. So one of the things I really like about Apollo, and I remember the first conversation that we ever had about it, was the brain state that is induced is similar to what appears on imaging as mindfulness. So it's a mindfulness state, a regulated state, without having to learn all of the tenets and practices of mindfulness. And I remember thinking, that's it. That's the hack. That's the life hack. Because so many people, I mean, we know mindfulness and mindfulness practices are so important. And it's daunting sometimes for adults, and then really a turn off for adolescents. So like, what are you talking about? You want me to be aware?
Just sit with my thoughts. Oh God.
Yeah, right. and then and then with children, I mean, there's some great mindfulness tools for children, but still it's so abstract that kids are just not ready to take on that kind of abstract thought. So it is a great example of a tool that brings regulation without a lot of effort, which, I think that we opened with talking about how stressful and busy and crazy and upside down things are right now. If you have a tool that is, providing that state without having to invest a lot of time, energy, work, or, it becomes the ultimate life hack.
Yeah, and I just realized while you were talking about that there are some people on this webinar who are actually not familiar with Apollo. So Apollo, I can tell you, I can show you. If you go to apolloneuro.com, I just dropped the link in there for you. But Apollo looks like this, and it is a wearable that is on a strap. There's a couple different size straps for different size people or different size limbs. If you wear on your ankle or your arm or your wrist. I personally prefer it on my ankle. I think that's about 70% of our users, but it can be worn all the time, and it delivers a very gentle vibration that feels, it's barely noticeable. It kind of feels like an ocean wave washing over you, or holding a purring cat, or somebody giving you a hug on a bad day. Everybody has a slightly different association with the feeling of Apollo, but it's basically music that is composed for your skin touch receptors instead of for your ears. And we developed this at the University of Pittsburgh. Through some of those contacts was how I met Amy and got in touch with her about her work. And we really developed it to try to help adults and children who are not necessarily good candidates for medicine have tools that don't require pills and don't require a therapist or a doctor, that they can use at home and basically take out of the office into their homes to be able to feel more in control of their own healing process. And it's as simple as, I think the closest thing to liken it to is when you're not feeling good and you want to be in a better mood, you put on a song you like, and all of a sudden sometimes immediately, sometimes within a couple minutes, you start to feel better. Your mind isn't as taken up by negative intrusive thoughts or negative thoughts about yourself or about your situation or about other things you're worried about in the future or the past. And you can kind of be more present and focused on whatever it is you need to do without worry, and more present in our bodies and the experience. And when we were working on this, we dove very deeply into music and the neuroscience of music and the neuroscience of touch and electrical treatment therapies that have been used for decades. And ultimately, we found out that those treatments can be great, but they are distracting and they can require more effort. And we can't listen to music all the time because we need our ears to do other stuff, like have conversations and that kind of thing. And so we started looking at is it possible to deliver a similar vibration pattern that music does in a more simple way to the skin than to the ears. And ultimately, after about 4 years of research at the University of Pittsburgh between 2014 and 2018, we figured it out. We tested it in clinical trials. And then we started testing it in the real world in doctors and healthcare providers, in kids, in Amy's clinic in Pennsylvania, and in adults who had adults with mental illness, adults who are high functioning Air Force pilots and military folks, as well as veterans and people who were in the community, who were just regular people who wanted to feel a little better or sleep a little better or have a little bit more of an edge. And so that is the gist of what Apollo is, and you can check it out at apolloneuro.com. And there are lots of other uses for it. What we're talking about today predominantly is sort of how Apollo represents a kind of tool that improves balance in the nervous system. It helps help us be more present it works in the same pathway as soothing touch and deep breathing. So deep breathing and soothing touch are really great. Again, they take practice and they sometimes require someone else to be around. We can use Apollo with many people who don't have access or have not learned those strategies to access similar techniques, but using it in combination with these techniques actually works better than using it alone. Using it in combination with psychotherapy or talk therapy actually works better, which is really interesting. And we've seen great results with that, not only in my own clients, but also in Amy's clients and with many others. And so Amy and I have been working together, or I should say Amy's been working with us as a group for the last few years to really pioneer this technology out for kids, because when it comes down to it, of all the people who get overprescribed medicine for a number of different disorders, from ADHD to depression to anxiety to et cetera, PTSD, kids are some of the most vulnerable, who actually have the most negative experiences with medicines, because most of the medicines aren't actually tested in kids in the same way they're tested in adults. And so that was a huge focus for us. And we've really done everything we can to try to push this through. And we're working on a much larger trial now that's very exciting, that we'll be able to talk about in a month or so in more detail. But that being said, getting back to what we were talking about a second ago, one of the other unique challenges that children are facing right now is re-socialization, right? And adults too. It's like they spend all this time learning how to socialize with their peers and with others, and then they're pulled out of school, they're pulled out of their community activities, and now gradually, little by little, they're being brought back into their community activities when allowed and when safe. What are some of the biggest challenges that you've seen in this area, and are there any strategies that you found that can help kids and young adults to have an easier time re-socializing or socializing again after so much time apart from each other?
Sure, yeah. So I had this I'll start with this story. I had this really interesting experience today. We've barely, I'd say, just started seeing people back in the office. We had the benefit of being able to see people virtually, and so we chose to do that. And I've started with a couple of kids, just testing the waters. And so it was common for us to do, I call it the walkie-talkie. It's something that I started trialing with adolescents. With teenagers, it's easier to talk if they're not face to face sometimes. And so on a walk, sometimes it's just easier for the kids. So I did a walkie talkie with someone today that ended up being walking around at an open mall. I thought it was supposed to be nice. It rained. Anyway, the whole time we were walking, we were talking about how the experience of just being out in public right now feels different, unusual, kind of new territory, and something that was so taken for granted and not even really part of awareness is now almost center stage. So the challenge for kids and it really does depend on where they were developmentally when shutdown happened. So it just happens the kid that I was talking to today was a freshman in high school. And so all the buildup, all the angst about going to high school, all the anticipation, all the excitement, and then boom. No, it just stopped. The opportunity to meet a whole bunch of new people happened in the fall, got shut down in December with holiday stuff, and then never came back. And so there's a whole group of kids, adolescents. I've even seen this in college age people. They miss their freshman year in college. They miss their senior year in high school. They miss and they've been isolated for a long time. And so there's a sense of, where do I even start? And when do I do that? Because it feels like if I start, it could get jerked away again. So there's a lot of, again, that kind of angst over uncertainty and just about regular social interaction. So I'm not talking about being really concerned about coronavirus and transmission, although everybody has an awareness of that. Their main concern is like, what does that even look like right now? And how do I make, what's a way to make that happen? It sounds maybe a little, well, it's the experience of young adults. So anybody over the age of 21 in this last year has just had a really interesting time if they were looking to date someone, trying to meet new people. I mean, it's changed everything about how that
Right.
happens. And so a lot of people ended up isolated and feeling alone. So reentry is about first figuring out, when are you ready? You know, what does that look like? And then finding ways to reengage that are comfortable. So I'm saying things like, don't ask for a big chunk of time. If you want to hang out with somebody, do it for an hour. Like, pace yourself. Don't expect that you're going to go hang out with a whole bunch of people all at once. Pick one or two. It's like really basic things that people are having to relearn. And even then, there's a sense of discomfort, right? Are you sick? Are you healthy? I don't know if you've had the experience. I know I have terrible allergies. My voice is hoarse right now because of that. And I frequently clear my throat. And every time I do it around someone, I'm like, I'm not sick. I'm really not sick. It's just allergies, you know? So there's this whole kind of dynamic, fluid situation that people are reentering into. Um, and I think that some of the strategies, the most important strategies, are to be thoughtful about how you do it. You know, to be thoughtful and aware and set it up for success so that reentry happens in a way that's very positive.
So what you're saying is, and you said a lot of good stuff there. One of the main things is, don't necessarily expect yourself to jump right back into the way things were before, right?
Right.
Like, take it slow. Start out hanging out with a couple people who you're close with in sort of a more intimate setting for a shorter amount of time,
Mhm.
and then gradually add more people and more time
Mhm.
as you feel comfortable. But don't necessarily expect yourself to go from one extreme of being relatively isolated for months to be jumping back into the way things were before, because that's likely to, based on all the uncertainty going on and a little more just general nature of more fear in others around us. And fear is a very contagious emotion, as we know. It's possibly the most contagious emotion, which evolved for survival purposes. At the same time, you know, that is not necessarily helpful when we're trying to re-enter into a social setting or a school or a workplace for adults and that kind of thing. So take it slow.
Yeah. Well, and for children, so coincidentally on the same walk, we passed probably a 18-month-old little girl walking with her mom. And you know, I just, children, babies, like my brain just is immediately attracted, like, what, oh look, a little girl, she's so cute, you know. And I watched her look at us, and I was watching her brain like try to use typical facial recognition thinking, you know. And with the mask on, it's a completely different like template. And so I was watching her and thinking, you know, wow, there's an entire group of children, toddlers, who have had a really unique experience of learning facial recognition and awareness, you know, with half of it covered. Um, so I think that there are aspects of this experience that we have not really started to pull apart. And I think that I would say to parents, you know, that awareness and mindfulness about the experience of the child, because a child's experience is not equal to an adult's. They're very different. Um, the other thing about children, you know, a strategy that I think is going to be really important is to think about kids as learners and to remember that they are learning. So we've spent a year teaching them that they must wear a mask on their face. And so now when I say to a child, in this setting for these reasons, you can take your mask off, they freeze. They don't know what to do because, kids are so concrete. So if you say you wear a mask whenever you're around, anybody else, and then all of a sudden I change that or I offer a different option, it's very stressful in a way that's physically very stressful. And so to be aware of that, and that we've had to teach kids a certain way of being for everyone's safety, and it's been inconsistent and it's been variable, and we're going to have to keep teaching them across time because it's changing.
Yeah, yeah, absolutely. And I love the way that you described the way that you go on a walk to talk, right? Like the walk and talk is so good. We don't use that as much in therapy. We used to more. I think that doctors and therapists used to say, "Hey, you want to go on a walk for your session today? If it's nice out." I know some people who still do that, but I don't think it's as common as it used to be. With children, that's a really great thing, because as you were saying, many kids don't, and even adults don't feel comfortable looking someone else in the eye when they're having a conversation about personal stuff. And just the eye contact in and of itself, eye contact is really interesting. It's incredibly important, but it also can make us feel uncomfortable at times, because what's the first thing you see when you look into somebody's eyes? Well, you see a reflection of your own self. And, that's not something that all of us are necessarily prepared for. And I think it's something that we can definitely do a better job of teaching children, because the nature of eye contact is so important in helping us recognize the similarity that we have between each other, right? That fundamentally as humans, we are, and really as anything that's alive, we are more similar than we are different. I mean, we are like 99.99% genetically identical. We're 99% genetically identical to mice for the most part, right? There's so many, we have so much in common with all living things. And that's why having, eye to eye contact is so critical. At the same time, if that's new to us, or we have had a long time where we haven't had that eye to eye contact, especially with strangers, going on a walk where you can gaze at, you can get a little exercise, get moving, right? Which brings us back into our bodies. And then also having the scenery around, the nature, just the changing environment, allows us to kind of get out of our heads, especially for children, but also for adults, get out of our heads and get into our bodies and sort of be more present with what we're feeling and more comfortable talking about it. And that's a therapy strategy that is really, really useful, that I don't think we use nearly enough. We expect that, hey, I'm just going to sit you down and we're going to talk face to face. And that's just doesn't always work for everybody. Maybe we'll get there at some point, but maybe that's not for everyone all the time.
Yeah, we co-located our space, our site, to a greenway on purpose. So it's funny. There have been times where a therapist would pass me in the hall, and I'd say, wow, you look really tired. What were you doing? And she's like, oh, I've walked 6 hours today. So it's good for the therapist too. But yeah, the walkie-talkie, being outside, doing something different, novel. We've been virtual in this year, so we've also had to do a lot of creative things to keep kids going in the virtual venue. So virtual stretch sessions and all kinds of stuff.
I think I'd love to talk about that just for one sec, because I think there's a lot of stigma against virtual care, especially with children, and it's extremely convenient. I see all my patients virtually now. You see most of yours, although now you have a new physical location. There are pros and cons of both.
Mm-hmm.
Do you feel, being the experienced provider that you are, do you feel that you're really, when you really bring all of your therapy skills into the virtual space like Zoom, do you really feel like you're missing that much when you're working with children? Or do you feel like, obviously there are certain things you have to do differently, but do you feel you're able to deliver the same quality of care that you can deliver in person or close to it?
Yeah, I absolutely do. And I think there are certain, I think of them as service lines or types of service. So types of visits that really lend themselves to virtual care. So if we're doing something with, medicine supplements or physical constitutional health, and we don't need measurements, or they can get the measurements at home, that is a really nice, that's usually a 30-minute visit for us. And that's very, very conducive to virtual care. An hour or 45-minute therapy session. We have speech therapists providing services virtually. We have psychotherapists providing services virtually. Everyone right now is 100% virtual, and we have had very little voiced concern, and we've asked everyone that I work with, hey, we're thinking about going back to the office sometime. What do you think? And by and large, there's an overwhelming request for us to, stay virtual. At the same time, I do feel like there are opportunities of being together in a physical space that can also be helpful. And right now, it's hard for me to discriminate right now, because when I see a child in person, it's been a year since I've seen them in person. And so there's this like reunion effect, I'll call it, where, it's so great and we're so excited to see each other. And they're so happy to be out of the house or out of school and in a different environment, that it seems like it's a really amazing thing. And I think that's really more of a kind of a reunion effect. So I think in the next year, we'll really be able to get a much more data-driven handle on that. We will certainly be asking those questions across time and following. But yeah, in general, I do not feel, I would say across the last year, I feel like we've had the same outcomes for families, for kids, that we had in the office. I don't think that's.
Yeah, I completely agree. And I actually think that even though there are some benefits, without a doubt, to seeing people in person, in the flesh, there are some tremendous benefits of seeing people remotely, like adherence, right? Like the no-show rate has dropped dramatically, which I would say is one of the biggest things that we see that impairs our ability to deliver good care, is that sometimes patients don't show up because they can't make it. There's other things going on in their lives that they prioritize over their health, or and that they just don't come in because it's a pain to come into an office sometimes, and maybe a lot of the time, and especially if you're seeing a therapist or a doctor, once a week or once a month, it's a lot of time, and you have to commute and everything. And so I think the one thing that I've seen, I think you've seen this too, because we've talked about it, is that when people are able to access care from home, they actually in some ways get better care, because they're having more touch points with their clinicians, with their providers, because it's easier to get to. And I think that's a big benefit. And it improves the consistency and structure, right? Going back to structure.
Right.
It makes more structured check-ins and that kind of thing.
Yeah, I would say that I just would add to that in general, the getting to and from an office, especially outside of work and school times, when families are trying to get dinner together or homework, or, before breakfast in the morning, that carries its own weight and stress in the life of a family. And so that in and of itself has been a tremendous decrease of stress. Just trying to coordinate and manage all of that. From my perspective, it's been wonderful, because I often consider all the variables in a situation. So I'll ask the question, how hard is it for this family to get this child to me? And so I would like to see this child in a week, but I'm going to say 2, because I think that's more reasonable for the family. Right. And so it's been so great, because now I can say, listen, I want to see you every 3 days for the next week or 2, and kind of really stay on top of this. And then we can go back to a regular cadence. So I feel like I've been able to give better care.
Yeah, that's the interesting situation that's going on here. I totally agree with you. There is another part to this, right? That's interesting where we're talking, I think we're going to talk about screen time because this is a big issue for kids, right? And then there's productive screen time, which we're having right now, having this kind of conversation, or like when you see your clinician. And then there's less productive screen time that's maybe focused on escape or distraction, or, just usually one of those two things, escape or distraction, doom scrolling or whatever, what have you. The word is so funny. But how do we balance that? How do you balance that with your clients? Do you have any recommendations for parents as to how to, screens are everywhere. Kids want them clearly because they're fun, but they're not necessarily the best for developing kids to have such an easy way to distract or numb themselves, or feel like they can escape from their emotions, because the goal is self-soothing. We want to teach children to be able to learn how to soothe themselves using what's right here, not what's right here, right?
Yeah.
So do you have any recommendations or thoughts?
I do. Again, there's kind of a timeline. So in the beginning of shutdown last year, so March of last year, parents were home, kids were home. It felt a little holiday-like, and there were loosening of rules like there are on holidays. And so kids are like, this is amazing. I get to play whatever game I want. My friends are all home. They are doing the same thing. It's so great, And then we hit this point somewhere in the middle where kids are like, oh my God, I don't want to be on another screen. This is horrible. Don't make me do it, And so I do think there's been, it'll be interesting to see what happens when there is a more evenly distributed opportunity for screen time. So right now it's school for a lot of kids is on a screen, therapy's on a screen, visits with family is on a screen. There's, it's just everything on a screen. When some of those activities go back to in person and more in real life, I think it's going to be really interesting to see what kids do with that. Because from my perspective, lots of children are so sick of screens, they can't wait to get outside. They can't wait to see their friends. They're really looking forward to doing visits with family and things like that. So I think we're going to recalibrate a little bit, which is exciting, because I do think that there are really important aspects of screen time, virtual learning, virtual care, those kinds of things that have tremendous value. And so I guess my thought is, be really interesting to see what happens. And for the most part, I trust that kids have internal awareness about it's like, every kid would eat ice cream all day or cotton candy or something if you ask them, do you want to do this, right? And then you let them and they feel horrible and never want to eat cotton candy again. It's like that cotton candy effect I see happening right now, so in terms of, I get asked all the time from parents, like, how much time should a kid be on a screen? And, does this mean that they can't play their favorite game with their friend because they were in school all day on a screen? And my kind of mantra for this year is, this year you got to do what you have to do. And so you do the best you can and you don't judge yourself. That inner critic, like put that away for a while, right? Because everyone is going through a time of great uncertainty and you do the best you can. So.
Yeah, absolutely. And I really appreciate you saying that, because I think many of us, our self-critics are really, high energy right now.
Yeah.
And it's critical to balance that self-critic with self-compassion, right? And to make sure that we role model compassion for our children, and not just say, oh, every day, all the time, do better, work harder, be better, but also it's okay to make mistakes, right? There's a real complex around failure that society models for our children, that we model for our children without even thinking about it, where we model a fear of failure and a fear of making mistakes, and then we actually teach that to our children without realizing it, and that is amplifying the self-critic, and it prevents healthy risk taking. Not like, we don't, nobody wants their children to like be aggressive risk takers, but we generally want, healthy risk taking is a way to grow as a human being and to really explore your full potential, and that requires a balance of the self-critic with self-compassion, which really facilitates a loving and understanding forgiveness that we will make mistakes, and then a gratitude for making mistakes, because every mistake we make is an opportunity to become better. Every mistake we make is an opportunity to become stronger and a better version of ourselves. And the best thing that we can do is not to harp on ourselves and drag ourselves over the coals for making mistakes every time, but to make sure that we learn as much as we can from those mistakes so we don't repeat the same ones again.
Yeah, absolutely. And the other thing I really would speak to parents about this, and I am banging a drum everywhere I go about this particular issue. I'm seeing more suicidal ideation in kids, younger kids and adolescents, more anxiety, more self-harm, more all of the things. And when I am talking to kids about this, the timing is not coincidental. This is the end of the school year. This is when all of the accumulation of grades and performance is routinely evaluated. And there is a very real sense of pass or fail. And so if kids have been able to kind of hold that pressure at bay, through whatever mechanism, it's really, they're having a much harder time. The reality is setting in. And my personal wish would be that we would just call this year a gap year, or just a practice year, and that everybody would stay kind of where they are, at least in middle school or elementary school, middle school, to have the opportunity to experience the school year that they didn't get this year.
Even for young competitive athletes, right? It's a big thing.
Absolutely, yeah. And that sense of failure adds exponentially to the already existing sense of loss. And I really, if I could point to the things that are driving that despair, that's what I'm seeing. And so for parents, I know as a parent and as somebody who works with children and adolescents every day, I know that wanting success for your child is because you love them. And that push to do better, to learn, to be successful is coming from a really sincere place of love. And this would be the year, if ever there was a year to give somebody a pass, it would be this year. To say, you know what, you tried, you did your best under really awful circumstances. And if it wasn't what you needed, let's think about how to get you what you need.
Yeah, well said. And that's actually a great segue into the next question I want to ask you, which is, what's the best way to get kids to try something new? Whether it's Apollo or breath work, or even like some stretching, yoga, just changing a routine. What's the best way that you found to help children do that?
Oh, I do this, right? Like all the ways. So there are many things that you can try. So taking a new opportunity, taking a new activity and pairing it with an activity that they already like. So I did this weekend. I invited a little girl to an in real life tea party, socially distanced outside. And at that tea party, we had 5 different foods and 2 drinks that she would normally refuse. And in that process, she got to pick what she wanted to try. And we made it a taste test so that, it was all about trying, different things, deciding if you like them or you don't and why. And that would never have happened organically. If we had been sitting at a table and I'd said, hey, look, here's muffins, let's try some muffins, it would have been hands down, no way, right? So pairing something new with an activity they already like.
That's such a great idea.
I love the kid in the background. That's awesome. It's perfect.
Unintentional, but
it's
perfect.
Awesome. Right? Having fun. So also introducing something novel at a time of low demand or stress. So a lot of times we ask kids to do something new in a moment where they have the least capacity to do it, right? And so really assessing, is my child in a place of optimal regulation to introduce this thing that I want them to do and try? I think it's also really great to join with a child. So not say, here, go do this, or I'm going to show you how to do this. But hey, I saw this cool thing and I want to learn it with you. I really don't know how this is going to go. So let's do this together. Let's learn it together. And then I naturally kind of cultivate this kind of curiosity about everything. So I'll say, hey, I don't know. I think that maybe if you drink more water, you could feel better in the afternoon, but I don't know. So let's do an experiment. Let's try this and see. Right. And then the other thing is, when you're asking a child to try something new, you want to set up the expectation that it's really okay to say, no, I don't like this. Right? It's really okay to say, yeah, no, I don't like this. And then explore why. Make it really natural and normal in the conversation to talk about why. Because you never know why a child likes or doesn't like or wants to do something. I get the funniest answers when I ask that question. Like, well, why? What don't you like about it? Oh, it's the wrong color. Okay, we can work on that.
Yeah. That's such a good point, children are often very, very adept at asking why. Right? I know that was one of my specialties growing up, to my parents' great dismay. But at the same time, reframing it back to the children and saying, well, you don't like this. Why don't you like it? And maybe there's like an answer that to them is very real, and to us is something that we can help them navigate better.
Yes, exactly. Yeah. So those are some of my favorite strategies.
Those are great. Those are really great strategies. And I think one thing that you mentioned that you did not mention, which I think is really interesting, that I know a lot of parents struggle with, is when you're communicating something new to your child, or communicating how you feel about a situation to your child, or about their behavior in a situation. And we sometimes accidentally, or on purpose, but I think it's usually by accident, label the child as having an illness or something wrong with them because they're doing something wrong. And I think there's a very important difference between saying, there is something wrong with you as a person, and your behavior in this moment is not okay, or it's hurtful to me, or to this other child, or whatever, right? Could you talk about that a little bit? Because I feel like children, in particular, adults too, but this is really a traumatizing thing for kids, that as an adult psychiatrist, I work with adults who are still struggling with their parents telling them these kinds of things growing up, and they have never really overcome it because they are still so identifying and so easily identifying with that idea that their parents taught them that there's something wrong with them, that they no longer even believe that they can get better on their own, which is really interesting, that they require medicine, or they require this or that or the other thing, or surgery even. And so I think, how do you navigate that with children, especially when you're giving them something like Apollo or a wearable or something that could be construed, or having them do like a computer game that's educational, right? Where you're trying to have them do something that is to help them behave better, or to think more clearly, or to be more focused, or to develop themselves in a way that, you know, that is different, or they might consider like academic or something like that. But it's really just to make them better or help them be better, but without labeling them in a negative way.
Yeah. So that is absolutely my favorite thing to talk about. So the idea, the concept, and this is really our practice is built around this foundational belief that we're not diagnosing or labeling or describing how a child or any human is broken. We're really understanding how they're built, how they're made, who they are. And from there, identifying areas of strength and weakness. With little kids, we talk about superpowers. This is your amazing superpower. And, you know, this other thing over here, you're going to need some work. So let's figure out how we use your superpower to help this get stronger. And thinking of it in that way, leveraging strengths and weaknesses, every human is unique. And it's really about understanding, not about labeling, diagnosing, or describing brokenness. That's super important. Early on in our practice, I did a tour. Somebody wanted to come see the space, and we did a tour. And at the end of it, he said, I get it. This is the place where you come to find out who you are, not to find out how you're broken. And to me, that was just the fact that he got that from the space was everything. It was amazing.
That's the whole thing.
Yeah, yeah. So I think that's really important. And as a parent, I don't know that I've said this out loud on this webcast, but my daughter has autism. I have a daughter who's 20, and she has autism. And a multitude of other strengths and weaknesses. Autism is kind of the way that I can describe it that people most relate to. And through that process as a parent, I can, you know, really empathize with the frustration of always trying to feel like you're encouraging and supporting and understanding. And, you know, when capacity and resilience are low, that's so hard. It's, you know, as humans, we kind of default to what we know. If you grew up in a family that was really critical or didn't have a level of awareness, you know, you can default into that. What I will say in my own personal experience and in 30 years of doing this work, you get more than one chance. You got lots of opportunities to instill that message. And if there's a bad day that happens and you don't say it perfectly, or you do say something like, I can't believe you did that. That's rotten. You're rotten. I can't take it anymore. It's not the end of the world. That you're still a really excellent parent. You're human. And because if you simply have the awareness, as you say it, like, oh, you know, I hear how that sounds, right? You're going to change it. You're going to do it different. So again, you do the best you can. And I would share that sense of encouragement to anybody, any parent that is part of this right now, because it's really important. You get lots of opportunities, and the consistent message is the one that sticks.
Yeah, that's absolutely right. And every moment is an opportunity, another opportunity to learn from our mistakes, to model how we learn from our mistakes for our children, and to pass on the message that we intend to pass on, which is that, you know, you're born the way you're born. We all are, and that's that presents us, no matter who we are. We all have our own individual challenges to overcome, and there's nothing wrong with us for that. That's just the way we are. And I think one of the things that I didn't learn until much later, but I thought had a dramatic impact on my personal development, was when I started to understand the language that I was using to describe myself, right? And we talk about this a lot because we're we're psychotherapists and we work in the mental health field, but this is so critical and something that we can pass on to our kids so young, just again, by role modeling how to talk about how you feel, how to talk about emotions, not to judge an emotion just because it's unpleasant or uncomfortable, and to say, oh, you should not feel that way, or I always am this way. For example, the most common ones that we hear are, I am depressed, or I am a depressed person, or I am a sad person. And that's bad, right? And so then what we're telling ourselves is, number one, to judge the sadness rather than to interpret it for what it is and sit with it, but to actually judge it, which prevents the interpretation of it. And then number two is we're saying that we are our identity. I am this emotion is part of my identity, which means that we apply it, even if we're not thinking about it consciously in this way. What happens is using those words applies that word sad or depressed or angry or fill in the blank of whatever, and anxious, to our past, present, and future self. It's not accurate. That's not true. We were not always sad. We were not always depressed from birth. We were not anxious from birth. Things happen and things stress us out, and the way we cope with them affects how we feel right now. But that could be changed based on what we do based on that information. That emotional information or signal that comes in is a signal to help us understand ourselves better, and then make a different decision, or any decision that's more aligned with our goals. So what we try to teach adults and children is to really take a step back from the I am statements, and to really move to the I feel statements, which really talk about how you are right now, because that's what's going on. If you feel sad, say it the way it is, right? I feel sad right now. Okay, if you feel sad right now, what can we do, right? If you say I am sad, or I am a sad or depressed person, or I'm an anxious person, all of a sudden it doesn't seem possible to change it anymore, right? And we narrow that window of opportunity for change just because we're using the wrong words to describe ourselves. So that's something that we can teach from a very young age very easily.
Yeah, it's funny. It's great. You said language, and the thought that I had in my head was, I remember learning this as a parent with my daughter Sarah, who's 23. And when she was a baby, I had great friends, a lot of people in the field, and so I got all kinds of books to read about parenting, and there were some really cool, amazing books that gave me a whole new vocabulary, kind of flipped the language, flipping the vocabulary, being really child-centered, and considering things from a child's perspective. That was so helpful. I'll never forget. She was a very high energy, sparkly little girl, full of life, full of everything, like just sparkly. And I can remember saying, oh, Sarah, stop, like, be quiet, like, calm down. What's going on? Why are you so, right? And one of the books that I read, the language was reframed, and so instead of saying, what's wrong, calm down, I would say, Sarah, wow, where's your energy? It feels like, to me, it's like really big. Do you feel that? Big energy, so talking about it in a very different way that was non-judgmental and non-shaming was really, really important, and powerful.
It's awareness, not judgment, right? So it's really, when we talk about this a lot, it's reserving judgment, which is very challenging when we've been taught to judge all the time. Yes. But it's really taking the first step to role model for our children. Let's draw your attention and your awareness to how you're feeling right now, without judging it, without thinking of it as good or bad. Mm-hmm. And then let's try to get an understanding of what this is trying to tell you, or what's this trying to tell us now, these feelings, and then we'll interpret it more down the road. Maybe there's no room for judgment at all. Maybe it turns out to be a good thing, that you're feeling that way. So it's really hard to know legitimately, as uncomfortable as some of our emotions might be, it is extremely hard to know whether that is a good or a bad thing in the moment. Usually we don't know until way later what the outcome is, right?
Yep. Yeah. The book title came to me. It was Raising Your Spirited Child. And it was just a spirited instead of, crazy, anxious, hyperactive, insert the word for spirited. And that was the first flip on, of the language, which was really, really helpful.
I love that. And we have a couple of really good questions actually from the audience. And we had a bunch that we've been answering along the way, but I just wanted to bring up a couple that I thought were really worth talking about, which is, for one, what do you do about social media?
Yeah, I was just scrolling through. That was the first one that I saw. Oh boy, I wish with all my heart I had a magic solution. I think it is right now the grand experiment of our time. It is a train that's left the track. You're not going to take it back. And so there is a journey for every parent and child that involves trial and error learning. And it's pretty individualized. I would want it to be. I would recommend that you try to individualize it. No two children are the same, even siblings, and so you can have one kid that's very sensitive and has a quick negative response to feedback, and another one that is pretty easy-go-lucky. Stuff doesn't seem to penetrate in a significant way. And each of those children is going to respond very differently to social media. And so for young children, I don't recommend any social media. That is not something that the
Agreed.
brain of a young child is prepared to deal with. And even through elementary school, I have strong recommendations not to bring that into the conversation. Kids are typically on social media in some way, shape, or form by third grade, and that is pretty young. So the early entree into social media is my recommendation is always that it's heavily monitored, that there are lots of safety strategies put in place. They're going to have an account, the parents have an account. I will also say that you can be the most proactive, forward-thinking, thoughtful person about social media, and your kid can still find a way around it. I'm living proof of that. We struggled for 4 or 5 years with some of the really negative things that can happen on social media with my daughter, and it was a real eye-opener and learning curve for me. So in terms of what can you do, be proactive, be thoughtful. There's all kinds of technology to help manage kids' access to technology. So learn about that. Think about your Wi-Fi.
Flip phones.
Yeah. Think about the Wi-Fi in your house. Think about the ability to lock out certain times. There's technology that can shut the phone down after 9 o'clock. So I would encourage parents to be really invested in understanding what's the best strategy for their family. And then beyond that, being open for when it goes wrong. And again, understanding that this is all about learning. So when your child was learning to walk, you could put some guide rails up. You didn't just like put them out in the street and say, go. You put some guide rails up, you let them fall sometimes, let them totter, let them get a sense
Training
of
wheels.
Yeah, it's the same thing with social media. Yeah, exactly. And there is a very dark side to social media. And I think it's really important to be aware of your child's behavior and, you know, notice the small changes. So in an adolescent, that's, you know, more social isolation. Like, I don't want to leave my room. That's lots of screen time, 20 hours on the screen, engaged. Somebody who was formerly pretty happy now is just really miserable. You know, that's something to pay serious attention to.
Yeah, absolutely. Those big behavior changes, particularly social isolation, is a really big one. I think, you know, I'm gonna take a maybe even a little less politically correct approach on that answer and just say that I personally don't think that, you know, and professionally, I don't think that smartphones are good for kids at any age. If you have a child where they need to have a cell phone and you need to be able to be in contact with them for any number of reasons, give them a phone that is not smart. There are great flip phones that are still out there. They can still text sometimes, or they don't need social media necessarily. Social media is like teaching your children, and it teaches adults this too, to care a hell of a lot about what others think about them. And it teaches that from a very young age, and it's not necessary. It's something that, you know, everyone has to learn to how to navigate that tenuous line of how we understand and know ourselves to be good and worthy in and of ourselves, irrespective of what other people might think. And there's that that battle has to be fought for, you know, on each of our parts individually, in all of our lives. And I think by giving young children access to smartphones or social media in particular at a young age, and I would say, like, you know, even by young, I mean like 16 even, I think is too young. I think, you know, because I see so many young adolescents I have seen over the years who have been cyberbullied via social media, and it is really traumatizing for them. I mean, it's awful, and there's almost nothing you can do. And I think, you know, we can't protect our kids 100% of the time, but we can at least educate them about, you know, the real risks of exposing yourself to a community of people that doesn't necessarily have your best interests at heart. That isn't really about real community. Real community is people who actually care about each other, who are actually looking out for each other's best interests, and who really, you know, have a vested interest in continuing to grow together, not a vested interest in showing to the world that I'm better than you are, right? And that is sort of what social media in its current form in a lot of ways is set up to do. And so normally I'm not the kind of person that says shield your children from this kind of stuff. At the same time, I think that, you know, there's still a lot of damage that's being done because of unrestricted social media. And I think that as parents, you know, that's, you know, at least trying to hold off as long as we can with our kids. It's not always possible, but to try to help them at least be educated about it. Just like with drugs, you know, abstinence and sex, abstinence only education only goes so far. You know, we can't teach ignorance and expect people to make good decisions. We have to teach knowledge. We have to share knowledge with kids and respect them as adults, as Amy was saying, you know, really share with them the knowledge so that they understand how to be safe, how to protect themselves and protect their, you know, their colleagues in their community, and what they can do and feel empowered by, rather than just sort of throwing them in the big sandbox of the world and saying, oh, you know, I'm not going to tell you anything because I'm afraid myself. So just figure it out on your own, right?
Yeah, outside of bullying and the damage that you were describing, I think there's also accidental exposure. So I kind of joke, but not, when I say, you know, well, a smartphone in the hands of a child, you just need to be ready to explain pornography to them. So if you're cool with sitting down with your third grader and talking about porn, then you are, you know, free to go ahead. And I say that for dramatic effect. And yet I have treated children for accidental exposure that led to all kinds of trauma and anxiety and, high levels of stress and behavior stuff. So I think that it really is, there's a level of seriousness about it that we don't often talk about. I don't hear people talking about that in uh, the media or, in general conversations. And yet it's real. And
Very real.
we also have, go ahead.
That's a good guideline though that you said. I like that as a rule. If you're not comfortable talking to your child about pornography and sex ed and drugs for that matter, it's probably not a good idea for them to have a smartphone. Because they're going to see it. They're definitely going to see it.
Healthy exposure. Yeah.
And I want to make sure we get to the very last topic that before you have to go, that a number of folks have been asking about, which is what's the best way to use Apollo from your experience with it with children, in the office, at home, from your perspective, and I can add a little bit later, but what do you think would be, or what recommendations would you give to parents who might have a child with OCD or anxiety, ADHD, depression or mood disorder? What advice would you give to them about how to use Apollo? Maybe not even just Apollo alone, but in conjunction with other tools as well.
Right. It's that in conjunction with other tools is such an interesting question. I would say that there's kind of two ways of thinking about using Apollo. So in one way, I think about teaching a child about regulation and different states of being, and then coordinating that with the different waves of Apollo. So it's almost like a game, like, hey, try this one. How does that feel? Do you like that one? Do you like that one? Do you notice that one? Is there, right? And then using it kind of across time, longitudinally. So not as a specific discrete intervention, but as this is something that's going to help you all day long. Let's play with it. Let's learn it and then use it. And then there is I am looking to change my state, kind of immediate use. And that's often a kid who's feeling really anxious, or a kid who is wants an extra kind of boost for attention or alertness. And so using it as an immediate intervention to change state. So those are the two ways that we think about using it. And I'd say both are really valuable. And you get the most out of the device when you are using it to full capacity. So like anything, let me take that. I'm going to step back, take that one step back. Many things you have to do a lot of work to learn how to use them in their utility. Apollo is nice because it works whether you really get it or not, or you really are sophisticated in how you're using it. With that said, you get the most out of it when you're making those connections, because at the same time that you are using it to its maximum capacity, you're also teaching your child and yourself, awareness, presence of current state, all of those things that we've talked about. So I think those are the two ways that I see it being used most effectively. And in conjunction with other things is also really interesting. You and I really haven't had a chance to talk about this much. So here goes, right? So there's a medical device that was approved for treatment for panic disorder and or panic level anxiety. And it really is breath training. It's a medical device that teaches breath training. It's measuring carbon dioxide levels on exhale, and we're starting to use it. And it's like a discrete treatment episode, 28 days. And I can't wait to use that with Apollo, right? Because you were talking about, like, there are things you can do right now, breath training,
Yeah, breath training and Apollo work really well together.
Right, right. So in a situation where a lot of times when I talk about breath training, it seems so cliched, right? And people, I think, in the last probably 20 years, mindfulness has been maybe overdone in some venues, or not really. It's been commercialized in a way that it really isn't true to what mindfulness is. So there's a lot of that going on out there. This is a device that actually is using feedback, immediate feedback of carbon dioxide levels to do breath training. And so it's just another way of teaching breath training. But I think it's my hypothesis is that it's more effective for somebody who isn't interested in breath training. Is like, I don't need a, mindfulness guru. I just need to feel better. I think it's helpful in that situation. So I'm excited about what Apollo gives foundationally, and then the other tools that we can start to add in to enhance the effectiveness.
And would you mind talking about, well, first off, I love what you were saying about using Apollo to teach emotional awareness, right?
Mm-hmm.
So Apollo has 7 modes. Those modes are energy and wake up, clear or social and open, and they go down from energy and wake up is the most energizing, and then they go less energizing from there. So it's energy and wake up, social and open, which is also creative, clear and focused, which is kind of a similar effect especially for kids, to taking like an ADHD medicine, but without taking a pill. Great for sustained focus on things that bore the pants off children. And then rebuild and recover, which is great for any post-stress, physical, mental, emotional. It's like a quick wind down. And then we go into, and that's the most balancing of all of the modes. And then going down from there, the much more calming ones like meditation, mindfulness, which starts to bring your attention more into your body, being aware of your body, aware of your heartbeat, your breath, the way your body feels, and helps improve access to mindful and meditative states. Then there's relax and unwind, which is the most deeply relaxing frequency that's most people use before bed, and to wind down at the end of the day. And then there's sleep and renew, which is what people use when they get into bed. And when you have a child who and most children start out not necessarily being aware of how they're feeling or why they're feeling a certain way, it takes a little bit of practice and training. And so especially when I've worked with kids with autism spectrum disorder, it's really fascinating, because you put it on them, and they don't necessarily have a specific goal in mind other than to want to calm down, but you run through a couple of the different modes and ask them how they feel, and then try to get them to verbalize for you how they're feeling differently now than they were 30 seconds, 60 seconds, 2 minutes before. And even in that short of a time, kids are so sensitive that they will figure out a way to describe it to you. And just that exercise of taking the feeling and verbalizing it is so incredibly important to teaching emotional awareness. And it helps them to be able to do that without the device on, and start to become more aware of how they're feeling and why they're feeling a certain way, and what to do with that feeling rather than judging it when it comes, which is exactly what we were talking about earlier. So it's really interesting in that regard. The other way is that we touched on a little bit, is like breathwork training. So Apollo vibrations are rhythmic, and the rhythms create structure for us in our day-to-day lives. So everything we do pretty much is on a rhythm, and when we're out of rhythm, we tend to feel disorganized and overwhelmed, and out of control. So kids, and most children, much of the time that they feel anxious and overwhelmed is because they don't feel in control of their situation. They don't feel in control of how they feel. They don't feel in control of their environment. They're always being told what to do, and that's when they become the most defiant, right? And even the best kids can become defiant in these kinds of situations. So giving them an opportunity to say, okay, you're actually in control of how you feel. This can show you. And this, if you breathe if you try to match your breathing, and do it with them, and try to match your breathing to the vibrations as they go up, and then exhale as they go down, which is at a rhythm that's similar to what we do when we meditate, it actually teaches breath work, which is of course the goal directed practice where you say, I want to, I need to focus right now for an hour, and I'm really, this thing is really boring me, or I have to sit still in class for 2 hours and I'm really bored or tired or what have you, or feeling like hyperactive or whatever, you know, that is, you know, or I need to fall asleep and I'm feeling really wide awake. Those are the kinds of situations where using it for a specific goal can be really helpful. And at the same time, it teaches the child, like it teaches an adult, but children tend to be more receptive to this, that they're actually in control of how they feel. And what could be more powerful, right? As a kid to and not powerful as much as it is empowering, to feel like I have some control in this. I have some say, right? It's not just up to everybody else. I have some say in how I feel about what's going on right now.
Yes, agreed. There are so many ways in which the Apollo augments other interventions, other care, other treatment modalities, and even, you know, you touched on it briefly, but I think it's important to highlight that every family is different, every child's unique, and in some situations, the decision to prescribe a medication or to give a child a medication is realistic. It can be the right one. One of the ways that I like to think about Apollo as augmentation is, if you're getting a basic level of regulation, then you know, if I were prescribing, I might need less. I might not need to advance dosing
I
across.
might not need my afternoon dose.
Exactly. You know, how about the Apollo as a booster versus an extra dose of ADHD medicine to get homework done? These are the things that I'm really, really excited about moving forward when we do the big trial, and then when we're able to really engage in protocol planning. Like, okay, this is, we're going to use it this way, you know, as our standard of care, because I think that's a really important piece. I don't meet many parents who are excited about giving their child a medication.
Yeah.
Generally, it's the opposite. Excuse me. Generally, it's the opposite. They're really not excited about it and don't want to. So having options is so important. I feel so lucky to be alive at this moment in time.
Likewise.
You know.
Yeah, to have access to the kinds of technology that we have
Yes.
is really incredible.
Yeah.
And maybe on that point, we could just end on one last thing before we let you go, if you have time. Do you have to run?
Yep, I'm okay.
Would you mind just, because we are starting this larger trial for children with ADHD and PTSD, which is we're very excited about, because the results that you've gotten to date have been so promising in the children you've worked with. Would you mind just giving a little bit of a preview as to some of the results you've gotten so far in our early pilot studies, and maybe what types of either situations or types of or kids that have different conditions, like or struggles, what types of things you've seen it work the best for, and then we'll end with that.
Sure. So I have to kind of, I'm ticking through the stories. So it's fun. It's so much fun for me, David, because I feel like I've watched you grow and build this amazing thing from almost the very beginning. So,
Yeah.
You know,
You're one of our longest users.
I have stories from really early on when you were figuring out the what the wearable is going to be like and look like, and we used some really early stuff in sessions. So this was in a session in a therapy room, and really all we were asking back then was, will a kid do this? Will they wear it? Will they tolerate it? Will they think it's cool or weird? Or, you know, so it's just kind of, will they do this? And those very first trials are the ones that I tend to like, they stay with me because it was such a profound effect. So, you know, I remember a kid that I still take care of. And I had at that point in time still been working with her for about 4 years. So I met her when she was 6, and so this would have been when she was about 10, and she had such big energy, like the biggest energy. And it was so hard for her to engage in a conversation. So we would get through it. We would in a session be able to talk about some things. It was always talk a little, do something, talk a little, do something. It was never, really cohesive and, organized. And so the first time we tried Apollo, uh, she sat on the couch and talked to me for almost 30 minutes. And I was in shock. I could not believe this was the same child that was, that I had just seen the week before. I had 4 years of treatment experience with this kiddo. And she sat on the couch and talked to me for 30 minutes. It was fluent, it was cohesive, it was, a conversation. And I just remember thinking, I had no idea what to expect. I certainly didn't expect something like that. And so that was my first aha moment where I was like, wow, this is really something. Over time, I love it that our kids have gotten to be part of the development. So giving feedback about, well, I like the way it looks, or why can't it be a watch, or, all the different things. I have kids that we did a trial at school. They wanted to try it at school, so we let them take it to school, and we taught teacher, everybody around them, this is what we're doing. And when we ended the trial, the child said, I can't go to school anymore. Without, like, I really need this to be at school. And so some funny, they're funny, cute kid anecdotes, and also at the same time really serious, in terms of the support that the device is providing for the child. So a kid who is able to feel in control of themselves in the classroom setting and experiences the ability to regulate their attention, and it's the device that's giving them that, is a kid who now sees themselves differently as a student, as a performance possibilities in the classroom. And that when we talk about that, I talk about, there's this negative downward spiral. I get in trouble all the time. Teachers always yelling at me. I can't sit still. I'm stupid. In this negative downward spiral. And then when you intervene with something like this, you can completely turn it back around and spiral up. So, wow, look, I'm feeling good. I had a good day. I got my stuff done. So it's so powerful in that regard. I'm really excited about being able to, we've talked about this before. I'm a research nerd. I love the data. I want to really get in and see, what's going on, and test it under different conditions. But at the end of the day, it's that basic concept of teaching the child is learning themselves how to regulate themselves, and the device is providing the input that lets them do that, and that's the key.
Yeah, that's it. And it's really incredible to watch, and I really appreciate you taking the chance with us, right? Because testing new technology or new therapies in children or vulnerable populations that we work with is always challenging. I think everybody has everybody who in their right mind as good care providers always has something in the back of their mind, like, I want to make sure I'm always doing the best and acting in the best interest of my clients, especially those who aren't capable of making decisions about their care that, somebody else is making decisions about their care. And, I think you really did diligence with us, and you tried it on yourself, and you talked to a lot of people, and yeah, and we really are grateful for your willingness to explore this as an opportunity to help kids and young adults, and to see how powerful it could be. And I am so excited for our work together in the future and where this is going, because, to be able to to be able to help just, if you could reduce the amount of medication burden, or the amount of diagnoses that are incorrectly assigned to kids, even by 5 or 10%, even by 1%, be a huge difference. But, we're looking at like potentially a 5 to 10% or greater improvement. We're seeing sometimes 50% reductions in anxiety scores in kids, much better ability to focus and communicate and make eye contact and have meaningful conversations with their adults and their peers. And it's just so promising to see that we can do this without drugs, right?
Yes. Yep.
And without somebody that's there holding their hand the whole time too,
Right.
which also they can't have all the time. So I'm really incredibly grateful to you for all of your work that you've done with these children. And I posted your link to your website, for the Children's Integrated Center for Success, everychildeverytime.com. Please check them out. And feel free to reach out to Amy and her work. And I believe you guys. Hey, are you still there?
I'm back. Yeah, it froze for a minute. I was like, ah. Can you hear me?
Hi, Amy. This is Rachel from the Apollo team. I think we just lost Dave, so we'll go ahead and you can say your thank you, and we'll.
It froze again.
Oh, there he is.
Well, so since we're having a slightly Oh, are we back? Amy?
I'm here. Can you hear me?
I can hear you. Can you hear me?
I can hear you.
Oh, it froze like at the last second. I was just going to give you the last word and thank you again for joining us. I shared your website in the chat. If there's anywhere else that you would like people to look at or reach out to you, or if you, I don't know if your practice now is expanded outside of Pennsylvania, but I just wanted to leave you with the last word to let everybody know.
Well, thank you. So we are in growth mode. Virtual care has allowed us to think more broadly about access. And so we're currently moving outward into states on the East Coast, California. We're kind of coastal and then moving towards the middle. So that's the long-term strategy or plan. Right now, Pennsylvania, New Jersey, Virginia, and Florida are all possible for us to provide care virtually. And then we're just going to keep going. So thank you. And thank you for your dedication to children, to humans, and to children, and fighting for ways that are congruent with their human being and helpful across their life, not just, a one-off. And keep it coming because we love it.
We'll do our best. It all starts with the kids. So
Yep. Yeah.
Thank you. And thank you everyone for joining us, and we'll see you again soon.
Okay.
Take care.
Bye.
Good night, Amy.